The Oarm is a new technology that's come out over the last couple of years that enables us to perform a CAT scan during surgery. Invaluable in some patients because it allows us to determine a patient's anatomy as they're positioned there on the operating room table. Then we can feed it into a special computer program which allows us to use that information during surgery so we can more safely and more precisely place instrumentation, remove tumors, do decompressions. The biggest thing is the 3D image. The spine, the body, it's three-dimensional. An X-ray is one-dimensional. Sometimes we do multiple X-rays, so we'll have two dimensions. But even with those two-dimensional X-rays, we're trying to put together a patient's three-dimensional anatomy in our mind. And with the three-dimensional information obtained with the Oarm, we're now able to have those details that allow us to improve upon our surgeries. It's exciting to be in the operating room and see a situation where you would struggle maybe for a half hour trying to precisely place a screw, and now using that bit of navigation, within a minute to 2 minutes, you can place a screw exactly in the perfect location. There's probably a couple of scenarios that this technology is ideal for. One would be that patient with a very complex spinal deformity. A normal patient, we look at this anatomy every day, and we know exactly where the screws go, and it's a very short and quick surgery in that way. Whereas if you have a patient with a deformity where the spine is either twisted or deformed in some fashion, the anatomy is totally obscured, and placing screws into that anatomy is very, very challenging. With this technology, it makes it 1,000 times easier. We're able to see three-dimensionally and know exactly where our screw needs to be placed. The other scenario might be a minimally invasive spine surgery. We're trying to do a surgery through very small incisions. Oftentimes, we're relying on X-ray guidance because you don't see the spine to place your screws or do your decompression. Having three-dimensional imaging allows us to see the spine and maybe perform some of these minimally invasive surgeries safely, more effectively, reducing the duration of surgery. By having the opportunity to essentially perform a CAT scan there in the operating room before we close, we can confirm that everything looks perfect before we're closing that patient up. The benefit for the patient is there's always a risk that something might be malpositioned during surgery. If there's an issue after surgery, obtain a CAT scan, and then the patient has to come back for a second surgery. Hope is that we're going to avoid that need for a second surgery in a small percentage of patients. The main benefit of the Oarm or intraoperative CAT scan is it improves safety for patients. With some surgeries now, utilizing this equipment, we can reduce surgeries by 2 to 3 hours, reduce blood loss, reduce the need for transfusions. Ultimately, this results in a shorter recovery for patients and a better outcome. Most patients, seek out and want to be at the place that's doing cutting-edge procedures, trying to do it in a safer fashion.